Hey guys, this is Dr. Celaya. Not too long ago, I was looking at magnesium and the different chemical and enzymatic reactions that it's related to. And the number was 300. Well, it grew to 400, 500, now it's 800 plus. It's so important for DNA and RNA and proteins and cell energy and healthy bones and even antioxidants. And it's been reported that 80% of people are deficient in magnesium. No wonder it's associated with so many different health-related issues. Let's start off with magnesium deficiency symptoms. In other words, taking magnesium will help with cramping. Magnesium works with calcium and it helps with muscle contraction. So if somebody has leg cramps, one of the first things I'm going to give them is magnesium and or calcium or a combination of both. You have to remember magnesium is part of the electrolyte system. And here again, we're talking about muscles and we have to talk about the heart. And it can help with heart arrhythmias. And there's some research that shows that it can even help with heart attacks. Muscle pain for the same reason. We have joint and ligament flexibility. There was a study in 2009 by the New England Journal of Medicine found that 50-year-old women with severe joint pain caused by rheumatoid arthritis also had low magnesium. Was it causation or was it a consequence? I don't know. Osteoporosis is another one, and they found that magnesium deficiency contributes to osteoporosis by acting on crystal formation and also on bone cells and indirectly by impacting the secretion and activity of parathyroid hormone and by promoting low-grade inflammation. I know there's a lot there, but bottom line is it contributes to osteoporosis. Insomnia. There's so many patients that are helped by magnesium, and magnesium causes a relaxing of your nervous system. It helps you heal better, repair, and it also helps if you get better sleep. It helps with your circadian rhythm, which can help with your adrenal glands, which can help with just about everything else. Constipation. When you have a lack of mobility, you can't necessarily go to the bathroom. Well, magnesium can help get the gut moving well. High blood pressure, and this is a big one for magnesium because it helps relax the muscles of the heart and arteries, like we talked about before. And magnesium deficiency can increase platelet aggregation and cause an increase in hypertension, which is blood pressure. Diabetes. Magnesium helps regulate insulin and helps with insulin resistance. And migraines. Here's a big one that a lot of people don't even know, that magnesium can help with migraines. And a decrease in magnesium decreases serotonin, which is a neurotransmitter, and can cause blood vessels to constrict. Fibromyalgia is an interesting disease because it can be a neurological disease. And magnesium, once again, helps calm the nervous system. And magnesium can increase that threshold, meaning you don't feel pain as easily. And here we have other neurological conditions of brain fog, mood, ADHD, and autism, grinding or clenching of the teeth, and even anxiety. Okay, so there are many reasons you can be deficient in magnesium, but the first one's alcohol. And what alcohol does is it upsets the balance between the minerals in your bones with calcium. And we also see an increase in free fatty acids, which decrease magnesium levels in your blood. It also is a diuretic, and a diuretic promotes the production of urine, which helps excrete magnesium and other minerals. Number two is caffeine, and caffeine stimulates the usage of magnesium and is also a diuretic. The third is digestion problems. So if you don't have appropriate hydrochloric acid, which is in your stomach, and enzymes, you're not going to digest the food and you won't be able to get the magnesium out of the food. Also, diarrhea and constipation can add to that as well. And bad diet. We'll talk about bad diet in a little bit here, but there's quite a bit to that. Soil depletion. Foods don't contain the minerals that they once did. I just read an article by the Scientific American, and they talk all about it. And it's a pretty prevalent thing. They recommend a lot of food rotation growing ideas, and it's a good read. Check it out. GMO'S, genetically modified. Some of the crops grow faster and bigger, which doesn't let magnesium absorb into the plant while it grows. And even if there is enough magnesium in the soil, it may not get into the plant itself. And there's so many different reasons not to eat GMOs, but that's just one of them. Another one is medications and reduction in magnesium. And there's a lot of medications that can cause this to occur. But they're diuretics, acid blockers, and heartburn meds. So basically with these medications, you're not able to digest your food and hence can't digest the food, can't get the magnesium out of it. There's depression medication, antibiotics, blood pressure medications, steroids, contraceptives, heart medications, and there's so much more. Sugars or refined carbs. And so the increase in sugar refined carbs do cause a problem with reducing your magnesium in your system. Aging's another one. There's so many different reasons with aging, but one of them is you're not digesting your food, not absorbing it, and the list goes on. And also genetics. Boy, there's a lot of different genetic conditions that can cause you to have a reduction in magnesium. And I won't get into them here because they're a little bit kind of crazy, but just know that it is something that can cause a problem. Okay, here are the foods that you can eat to help you with magnesium deficiency. Green leafy vegetables, and we're gonna take a little detour here, but you can see why I put on this slide. Greens, greens, greens. There's a reason for it. Here we're going to take a look at the differences between plant chlorophyll, which helps the plant get its energy, and also human blood hemoglobin, which helps bring oxygen to your body's cells to get more energy. And you can see it looks very similar. You have a porphyrin ring structure, and one of the main differences that you can see plant chlorophyll here has in the very center a magnesium molecule, whereas the human blood porphyrin ring structure has an iron molecule in the center. You know, there's been a lot of research that says if you eat plant chlorophyll, meaning greens, that you can better manufacture your hemoglobin. Well, the research doesn't show it either way, but at bare minimum, it helps you get an increase in magnesium. And that's why magnesium is really prevalent in greens. It's because of the chlorophyll. All right, the next is chocolate, and I know you guys are really happy that I brought up chocolate. But chocolate in moderation, you have to make sure that it's a certain amount of cacao, 65, 70% plus. In addition to, you have to minimize the sugars because then that creates a deficiency in magnesium. So chocolate just isn't chocolate, right? So be careful. Don't think this is just an okay thing to start eating candy. Avocados are great superfood for so many things, and they really help with magnesium. Beans and seeds, especially pumpkin seeds. And pumpkin seeds not only have magnesium, but they're really good with zinc. You have nuts, you have tofu, you have bananas, and even fatty fish. And I like salmon. I think it's a really good source. There are a lot of other foods as well, but these are the main ones. Okay, so which magnesium is right? It's just like about anything else. There's a lot of different types. And the first one is magnesium chloride. And what it does is it helps with detoxification and also your kidney health. Next, we have magnesium citrate and oxides, and they're really good for regularity. When I have a patient that has constipation or isn't really working well in their gut, I'll give them the magnesium citrate just to help speed things along. It also helps with energy, the citric acid cycle. It can help with blood sugar, helps balance calcium and reduces calcium buildup. Next, we have magnesium chelate, and what that is they sandwich magnesium between two molecules of glycine. And sometimes those carriers help it get absorbed faster. It's a pretty darn good form. It really depends on the other forms and what's needed as well. It can help with bone health and even digestion. Usually magnesium can be deficient with certain stomach issues, and chelation helps reduce this. It can help support muscle relaxation and function, which is vital to cardiovascular health, since the heart is a muscle, right? It can help with sleep because it relaxes muscles and even blood sugar. It helps cells absorb more glucose. And kidneys, they can help reduce calcium deposition as well. Next, we have magnesium malate, and it's a form of magnesium that's bound to malic acid. You know, it's the stuff that's a tart flavor in rhubarb and green apples. And magnesium is cofactor in so many enzymes that harness energy from carbohydrates, while malic acid is an intermediary that helps generate energy in the citric acid cycle. You might have heard about the Krebs cycle before. Magnesium malate's good for increasing energy and also decreasing fatigue, and they go hand in hand. You have magnesium taurate and orotate. It's good for cardiovascular health and arrhythmias. And here's the new kid on the block, magnesium threonate, which is a magnesium that's chelated to threonate acid, which is a metabolite of vitamin C. It's better to other forms of magnesium because it can help get through the blood-brain barrier and also lipid cell membranes. It can help with sleep, mood, brain fog, relaxation, and stress. There's so much new information on it, and this one seems to be a great one, and we'll see in time. You can also take Epsom salt baths with magnesium sulfate. This does absorb, believe it or not, and helps with the different phases of liver detoxification. And if you want a food-based, you can look at my heirloom greens. And here again, it goes back to the greens and magnesium. How much should I take is the common question. Well, it really depends upon what your scenario is. But as a starting point, anywhere from 300 to 500 milligrams a day. The big question is, how much is too much? Well, you're going to know when you have too much. You may have a little bit of diarrhea, depending upon the source that you take here. Usually I get somebody to diarrhea, like again, it depends on the source they're taking, and I just back off a little. Most people are calcium dominant, a 10-to-1 ratio, and we want a 1-to-1 ratio with calcium and magnesium. Okay, so what about testing? Well, you know your normal testing that you're looking at your serum when you go to the lab and they take a look at your blood and just see what's in it. Well, it doesn't really work that well for magnesium, just like it doesn't work for calcium. You have a pretty big store of magnesium and calcium in your bones, and your body's going to make sure that your serum levels are pretty consistent, right? Because it'll pull from those areas, those storage areas. So one test I do like to look at is within the white blood cell. We can take a look and see what our magnesium levels are and to what deficiencies we might have. It's really the best thing we have at this point in time, along with the different symptomologies that we talked about, and even more of them, to understand if we're dealing with a magnesium deficiency. You have any more questions about magnesium? You can go over to my website, drcelaya.com. That's drcelaya.com. And you can schedule for a free 15-minute consultation or even to become a new patient. I hope this helps.